I'm Stephanie Lodding, and I'm a dental hygienist. I own Now to Wow Hygiene Consulting, and I really find it one of the most important months of the year, April, as Oral Cancer Month. And I wanted you to meet my friend Brad, who I would like him to tell his story from his perspective today about how important it is as a hygienist and as a doctor that you're doing oral cancer screenings and that you are truly helping to save lives. So with that introduction, I want to pass it over to Brad and talk to Brad a little bit about his story and how we met. So Brad, I'd like you to tell us a little bit about your story and about what happened to you, and give us a little background on who you were before you were diagnosed with oral cancer, and give us your story.
This is me shortly before I was diagnosed. It was near the end of 2012. I had persistent earaches and a little sore spot on the back of my tongue. I went to a corner kiosk doctor, and they told me, oh, that's nothing. The earaches persisted. The sore spot didn't seem like it was going away, so I went back again. They said, oh, it's nothing. Your tooth is rubbing on the side of your tongue. Of course, I was relieved to have them tell me that it was nothing. A couple months had gone by. I went back again, and they still said, it's nothing. You have to take care of the tooth. So I finally did do that, and I went to a local dentist in my area to have the tooth extracted, and even asked him if he had ever seen anything like this little abrasion. And at that time, it was a very small little abrasion on my tongue. He suggested that I was biting my tongue in my sleep, and that within a few days of the extraction, that it would all clear up and I'd be fine. Well, a few days went by, a week went by, and it didn't get any better. So I went to a different clinic, and they stopped me in my tracks and said that it could be something very serious, and wouldn't let me leave their office without consulting with a specialist. Of course, I was still of the mind that it wasn't anything serious, and even though they were a bit alarmed, I thought, oh, no big deal. So I went to the specialist, and he looked at it for 2 seconds and said, oh, you have cancer, squamous cell cancer of the tongue. And I was in shock.
So they said it was squamous cell?
Squamous cell cancer of the tongue.
Do you know what stage?
At that point, no, but it ultimately ended up being stage 4. Had it been properly diagnosed months earlier when I did seek treatment, my results would have been different. Even there, I was in shock and really in disbelief. I stopped, as I was getting ready to leave the office, I turned around, I said, but not cancer. And he grabbed me by the arm, and he said, Mr. Rorson, he said, this is very serious, you need aggressive treatment immediately. From there, he referred me to Cook County Stroger Hospital. I was uninsured and very worried about the financial impact of it. While at Stroger, they told me that they would have to split open my jaw and amputate a large portion of my tongue. It would affect me greatly from there on out. I, of course, resisted that. Their initial prognosis was 3 months survival rate. That's if you do nothing.
So I want to remind everyone, as we're listening to Brad's story, what he said is he had 3 months prognosis, and he had squamous cell, which was diagnosed in stage 4. And that's where what we're talking about today is so critically important for you to understand, that he should have never been diagnosed in stage 4. We have the power as hygienists and doctors to investigate, do thorough exams, and find it in stage 1 or stage 2, so the outcome could have been much different.
Yes.
So I want you to continue with your story.
They also told me that they had to remove all my teeth which I was hesitant, but you're trying to listen to what the doctors are telling you. Still in a complete state of shock. I went ahead and listened to them, which it did turn out that the removal of the teeth is an antiquated form of treatment, and it severely impacted, how I am now and eating and whatnot. After 2 months of being at Stroger Hospital, they did not start a treatment plan. That would be 2 of the 3 months that they had given me to survive. At that point, I walked away from Stroger Hospital, and through the help of my church, they petitioned University of Chicago, where I met Dr. Everett Vokes, the #1 head and neck cancer doctor in the country. It all seemed like, it was divine intervention at its finest. I then began a brutal course of treatment, although they did not have to amputate my tongue. They were very regretful that I had all my teeth pulled. It was just heartbreaking at that point. Tons of chemotherapy and radiation, which even that is pretty barbaric. They strap your head down to the table, you can't move, you have this lollipop type thing in your mouth to protect some of the tissue. Despite the fact that I'm still breathing, I really struggle with how this has left me. Mrs. Lodding's efforts in making people more aware of oral cancer is really, really, really admirable. They've come into my life and have helped me a great deal. I still struggle with eating issues. The damage on my tongue is pretty severely paralyzed. I'm actually lucky that I can speak at all. And eating is a major issue. Anything involving chewing is virtually impossible. Essentially a liquid diet, runny mashed potatoes, yogurt, soups. It's really quite overwhelming. So Mrs. Lodding.
Well, and one of the things that I wanted to talk about too is the fact of how Brad and I met. We both are lucky enough to go to the same church, and that's how we were lucky enough to meet. But we were involved as he was going through treatment, and it was so difficult because he didn't have a smile at all. They actually extracted all of his teeth and left him with no smile. And when we found out about his story, we stepped in because we wanted to give him a smile back and give him something to feel good about in the eyes of the darkness that he was going through and the difficulty and the pain. And it was really a difficult time for him because he was in so much pain and he was going through treatment. And one of the most important things that we all know is the gift of a smile. So we were lucky enough to be introduced to one another, and it's been an amazing journey ever since. He's still dealing with a lot of pain and a lot of discomfort. He does have a beautiful smile again, but we're still working through the hoops and the hurdles because of the surgery, because of the pain and the discomfort of the sores that he continues to have, the severe dry mouth, which is what's creating a lot of the problems, and the secondary infections that we can't seem to completely eradicate because of the difficulty with the lack of saliva. And so the biggest story that I want you to all to understand today is how important what we do in dentistry really matters. And it's as simple as literally putting on these glasses just like this and shining a light in someone's mouth to find out if they have oral cancer. Hygienists can do this, doctors can do this, and had Brad been to a dentist in our local area that would have used these types of instruments, there's the Oral ID, there's the Valscope, there's several other products on the market, but had anyone taken the time to actually look in his mouth with one of these lights, his outcome would probably have been much different. I'm so excited to say that his 3-month diagnosis has turned into how long?
I'm in remission for about 2 years now. Still several issues. I'm still breathing and I'm still here, and I'm very proud to be alongside Mrs. Lodding and helping people be aware that early detection is the key. As soon as you have any sort of issue or in your routine dentist visits, this device is so critical, and it should be mandated in every dentist. Should be part of every routine examination. It's regretful that my dentist did not know and did not take that course of action.
And one of the things that Brad shared with me early on when I met him was the fact that he had gone in multiple times asking about that sore in his mouth and was turned away saying that it was nothing. And so nobody took the time to take an extra look or to give him a referral to someone that could take an extra look. Oral surgeons, somebody that could do a biopsy, somebody that could take a look that knew exactly what they were looking for. So if you're unsure about an area, you want to wait about a week or two, have the patient come back. If you're still unsure and it looks the same, please do a biopsy or please do a referral. You need to, on Monday, because we're at the end of the week, you need to order one of these lights and you need to get your staff all trained on how important it is for oral cancer screenings. And you need to start next week and do oral cancer screenings on every single one of your patients every single time. With Brad's story, I think how much different things could have been for him and how difficult his journey has been in the last 2 years, and I'm grateful that he's still here with us. But I get emotional in hearing his story because it saddens me that one more person like Brad is dealing with what he's gone through. And so I'm just very, very grateful that he's decided to share his story with you and let you know how important one change in the road that he's been down and the difficulty that he's been down, because let's face it, he had barbaric treatment. He had all of his teeth extracted when that's really not the way that oral cancer is treated anymore. And the one thing that if I can impact any of you is to help your patients through the treatment from beginning to end. Make sure you find doctors in your area that you can refer to, that you're very confident with and that you're very comfortable with in taking care of your patients. Let's not find a place where our patients are being used as guinea pigs, because I really look at what they did to you as actually just absolutely barbaric treatment, and I want to make a change and I want to impact the world in a way where this doesn't ever happen again.
Cancer as a whole is on the rise. Oral cancer is on the rise. A more widespread virus called HPV, human papillomavirus. Mine was not that type. However, it manifests in women as cervical cancer and manifests in men through heterosexual sex as tongue cancer. This can happen to anybody. I'm a member of a cancer survivor group of my exact type of cancer. Some of them are completely back to normal, others are not. Please heed Mrs. Lodding's advice and get screened, get treatment. Early detection is absolutely the key. And I thank you, Mrs. Lodding.
And I just love that he even knows the statistics on oral cancer, and he knows that oral cancer is on the rise, and it is no longer men over the age of 50 that are smokers and drinkers. It is now moms and young ladies in their 30s and their 20s that are now getting oral cancer because of HPV virus. So there is products out there that you can actually test for HPV of the mouth. It's a conversation that we absolutely need to have in the dental office as well. And it can be done in a very comfortable setting if you know how to utilize the information and have that conversation comfortably. But getting the word out is really, really key. Educating your patients, doing blogs in your office, and really getting that information out there. If you have questions about the things that we talked about today, please reach out to me at WNAFLOSS@AOL.com, wannafloss@AOL.com. And my name is Stephanie Lodding, and you can reach out to me at any time if you have any other questions at nowtowowhygiene.com. Thank you so much, Brad. I really appreciate you coming in, sharing your story with us today, and really impacting the world of dentistry, because with your story, I hope that each dentist and each hygienist that watches your story will think about you every day when they go into their office and never make a mistake of not doing oral cancer screenings again. So thank you.
You're very welcome.